really only two medicines that you can take for when you, what we call these rhythm drugs, okay? There's only two medicines you can take. One is amiodarone, and the other one is, it's a somewhat similar medicine to amiodarone. It's called Multac or dronetadrone, okay? So medicines like the metoprolol that you've been on, and the diltiazem.
No, I haven't been on it recently.
I know. I'm just saying.
Was way back.
Yeah, and currently I think you take a medicine called metoprolol.
Yes, and then when I went into the emergency room, Dr. Belden wanted me to off the Lasix and to cut back on the beta blocker significantly, and we talked about that with Dr. Sven, and he said, yes, we'll cut back on the beta blocker.
Right, with using the amiodarone, he was going to cut back. But those medicines like the metoprolol and the diltiazem are what we call rate control medicines. They help to try and keep the rate from being too fast, because that's usually for most people what causes them to not feel good is the rate of the.
Oh yeah, it used to be like that, but when Dr. Belden took it, it was just a smooth. That's what I don't understand.
But you were still out of rhythm. It's just that the rates were probably better. Okay, but the atrial fib, the atrial flutter, I said with rate control medicines, all you're really doing is controlling the rate. It won't keep your heart in rhythm. Medicines like the amiodarone or the dronetadrone are medicines that would help to keep your heart in rhythm.
This is a killer. It says, sit up, you'll be dizzy. I'm already dizzy. I really had a bad reaction.
No, I understand that. And I hear that this medicine may not be the right medicine for you. The other choice, as I said, would probably be a medicine called Multac.
See, I don't see Dr. Sven then until, I don't know, I said, you're here because your mother's husband is here and they're going to let him go. And I said, I'm just going back to Crawfordsville with him. And
well, that would be one potential, is that we just, keep you on your same medicines, maybe try and adjust things slightly, and then get you back to see Dr. Schwed to discuss things further. The other thing is, I can try and contact Dr. Schwed and let him know.
I wish he'd have discussed this with me. See, he said we're just going to try some new medicines and maybe a procedure. And my older friend was with me, and we agreed, and I'll come down here on Monday. But then I fell yesterday, and they wanted to take me to Crawfordsville Hospital. I said, no, I'm going here on Monday, where I know they'll do a great job. And the ER is excellent here, Todd. Dr. Belden, and of course Adam has to do he's about the only one that can get into my veins that are so difficult.
Is that Adam Dawkins?
Well, he's in the ER, but he came in and did this today because they can't, they give up. They went in here, they can't do it. And he does it every time. He said, I did it for your surgery with Dr. Hymanson. So, I felt I just gave them a wonderful rating, a top 10, because they really were very caring, and they made sure she said, you see Dr. Kwan Monday morning. Well, he was on vacation, so I saw him Tuesday. He said, I'll take you off the Lasix and put you on triamterene, which I've been on for 15 years. And I'm not swollen anymore. So, and I'm not having, because that causes a lot of dizziness. But this is also causing dizziness, and this is the one you.
Amio has the potential for a number of side effects. A lot of side. It really is a very good medicine. We use it for both atrial and ventricular rhythm, so it is a very good medicine. But it does have the potential for side effects, and a lot of people don't tolerate it very well.
No, I didn't. I just wish he'd have discussed it, and then he put it, you're going to have to take it. I said, no, I'm not. Because I must have the right to say, no, this is my life.
Yeah.
And my daughter's concerned because, I fell yesterday, I got dizzy. So,
something needs to be done. So what is your suggestions?
Well, I said one would be to try to try the Multac, which is it's similar to amio, but it doesn't have the total package of the side effects that amio does. Okay, would be to try that and then do the cardioversion and see.
See, they did it in San Antonio and it did nothing. So this is really, I've had it twice now.
Right.
And it looked like the rhythm was fine. And
But then you go back out of rhythm and so it reoccurs.
Was that the plan all along, to change her med and then do the aversion while she's in here?
Yes.
Well, that's what we understood, you know, when Rhonda was with me.
Yeah.
But he didn't discuss that he would be giving me something like this. You know, and then he didn't.
That's kind of what I think what he implied was that he was going to put you on a new medicine.
Yeah, a new medicine.
The amiodarone.
But he didn't say the name.
And then after kind of loading you up for a few days, then would do the cardioversion.
Todd, the problem is I can't take medicine, and they give me too much each time, like anesthesia. I just don't metabolize it. Even Benadryl puts me out for the day. So it's hard to tell people at 200 pounds that I can't take, you know, this much medicine.
Sure.
So I just feel like my life is on the line right now. And I just thought, well, I'll go on back and call Dr. Pong and say, give me a calcium channel blocker. Wouldn't that work?
Well, what it would do, it would just help to control the rate, but it won't convert you or maintain rhythm if you would go back into normal sinus rhythm.
Well, I just love to get rid of the dizziness because I developed it after the cardioversion.
Right. Well, the dizziness is probably related to the being out of rhythm and everything, so the one choice would be to try the Multac and do the cardioversion and see how it goes. Another choice would be to try and push up your rate control medicines to make sure that the rates are better controlled. And then,
which would be what medicines would rate?
Well, we'd have to look. I mean, it could be adding a little bit of the diltiazem to what you're already on. It also depends on what your blood pressure is.
It was very high when I came in August 6th. It was 191 if you check the ER. Yeah. And then it's down today.
I didn't see what your blood pressure was when you came.
157.
Yeah, so you have plenty of blood pressure, so we could probably go up on the other medicines to try and achieve better rate control.
Well, Todd, should I do this or take some medications and have them filled at home?
Well, I think it's up to you. I said I try and reach Dr. Schwed, but we can do both things. It might be reasonable to admit you and try and get things a little bit more rate controlled if you don't feel like you want to try the other medicines. And what if we can't control the rate? There's always the possibility when the people can't take medicines, don't tolerate them, we can put in a pacemaker, and then what we do is,
that's what Dr. Hymanson asked him.
But it's for a different reason. It's because of when you can't control the rate of the rhythm, atrial fibrillation or the atrial flutter, we put in a pacemaker, and because we don't have and what we do is
my sister
we cut the junction box between the top and the bottom chambers. So the top chamber can do whatever it wants, but the pacemaker takes over and does that.
That sounds like a good, because I don't do well in medicines. I really don't respond.
But what we would probably, probably try to do, because what it does is it makes you pacemaker dependent that way. And usually what we try and do is we try and control the rates, and then if people can't tolerate, because of blood pressure or the rates just aren't able to be well controlled and just don't feel good, then that's where we go to the next step, which is the pacemaker and the what we call the AV junctional ablation.
I'm just getting dizzy now, so I just wish we could.
Why don't we admit you, and then we'll take a look at things tomorrow, and decide what direction we're going to go. We won't do this.
But I mean, tonight I would not do my Eliquis or whatever.
No, you would continue your Eliquis. You would continue all of your same medicines. I may try and adjust something up a little bit.
Well, see, they told me to get off the beta blocker, and Dr. Belden here said just take very little until you can. I don't
How
know,
much were you taking at home?
a quarter of.
You weren't taking much at all.
No, I wasn't. It was 25 milligrams.
A quarter tablet.
No, wait a minute. 12 and a half, and 12 and a half. And so I went to a quarter of a tablet, 6 milligrams. To just, I took some this morning.
You actually need more. You need more like the 25 twice a day or whatever.
Oh, the beta blocker?
Yeah.
What does that do?
Well, remember, that's the rate control medicine. That helps to control your rate.
Well, why are they saying I need to get off of it then? I don't know.
I think, again, you weren't, that's Dr. Schwed told you, or that's what somebody else told you?
Well, he said we would go with something else
Right.
rather than the beta blocker, and then
Right. The
Dr. Belden
amio
said-
works as a rate control medicine in addition to being a rhythm medicine.
But I could avoid taking all these medicines that I don't do well in with a pacemaker.
No, because we would try and control the rate to well enough and see how you do. If you did continue to not feel well, then we would go the pacemaker
Well,
route.
when the pharmacist, and Karen is very nice, she's outstanding, she listened.
Right.
She said I would be taking 3 times the dosage here, but you only normally take 1.
What we
Well, I
use-
would be dead taking that.
What
I hear
we
you.
normally do with the medicine is we do give a higher dose for a few days because it takes a while to build up in the system.
Todd, I just can't take a lot of
I
medicine.
understand that, and I'm saying let's not do this.
Okay.
Let's just admit you tonight. We'll adjust your medicines just a little bit, and tomorrow we'll either in discussing with Dr. Schwed or Dr. Olson, who's rounding this week, we'll decide on the best plan for you.
Will you be around, Todd?
I will.
Because I need somebody that will listen and you listen.
But they want to help you and they want to
Well, I
listen.
know, this
You know,
is a
but I'm-
wonderful place, but
This
and my daughter is very concerned that I'm going back home and not getting
Right.
help.
Right, and we all are, because if you go back home without help,
So yeah,
We're
rather
gonna be
than
back to
make
square one.
a snap judgment at a 4:45, let's get you admitted,
I
and
don't have a room, Todd.
oh, they will. Yeah, they'll be.
they'll find you one.
Yeah, or
I may be
if
sleeping in the hall.
worse, you could stay down here, but there's beds upstairs. And
Well, if you'll just, and Bonnie, are you a nurse also?
I'm a nurse practitioner.
Oh, my
I'm an acute care
goodness.
nurse practitioner. But I just want to give you one piece of advice.